Hello, everybody. Welcome to this NLIHC webinar, as well as a National Alliance to End Homelessness webinar, as well as a National League of Cities webinar entitled Non-Congregate Sheltering During the Pandemic, Using New FEMA Policy to Save Lives. We're going to let folks hop on and get themselves situated, and then we will get going. Thanks so much for joining us, and we'll get started right in a minute. Hey, for folks just joining us, this is the Non-Congregate Sheltering During the Pandemic, Using New FEMA Policy to Save Lives webinar, sponsored by the National Low-Income Housing Coalition, the National Alliance to End Homelessness, and the National League of Cities. Just gonna continue to let folks hop on, and then we'll get started very shortly. Just a heads up. Thanks so much. Great. Well, I think we're good to get going. Again, this is a webinar entitled Non-Congregate Sheltering During the Pandemic, Using New FEMA Policy to Save Lives. It's sponsored by the National Low-Income Housing Coalition, the National Alliance to End Homelessness, and the National League of Cities. I'll introduce our panelists in a moment, but I wanted to mention the Q&A box is open. So you can post questions as they come up. We'll go through a series of questions and answers with the panelists, and then we'll turn it over to Q&A. And just so everybody knows, this webinar will be recorded and posted online through NLIHC's media channels for future reference. So today we have on the line Anna Leva, visiting senior fellow at the Center on Budget and Policy Priorities. Jason Elliott, senior advisor to California Governor Gavin Newsom. Germán Parody and Shaylin Sluzales, co-executive directors of the Partnership for Inclusive Disaster Strategies. Joy Moses, director of the Homeless Research Institute at the National Alliance to End Homelessness. And finally, Andrianica Morris, executive director of Housing NOLA. Housing New Orleans, of course. So on March 13th, which actually I realized as I was pulling things together, on March 13th, 2020, which is just about a year ago today, President Trump issued an emergency declaration under the Stafford Act that approved FEMA public assistance for emergency protective measures. covering non-congregate sheltering. It was right around now that I first read the word non-congregate shelter. I'm not sure if at the time we all realized how much we would be saying and typing out those words in the coming year. But I think it underscores how the pandemic has forced us to really equate housing and healthcare in a very real way, in a very tangible way. Safe shelter like that provided in non-congregate sheltering, like in hotels, is pivotal not only to slowing the spread of the virus, but also to ensuring that the folks that we care about, whether they're unhoused or residents of congregate care facilities, are able to survive this pandemic. People experiencing homelessness and folks with disabilities who live in congregate settings are among those individuals who've been hardest hit by this pandemic. They've been suffering from high rates of illness and death due to coronavirus. Folks who are homeless and contract coronavirus are twice as likely to be hospitalized, 2 to 4 times as likely to require critical care, and 2 to 3 times as likely to die from the disease than others in the general public. And the pandemic has also devastated folks with disabilities and other individuals residing in nursing homes, psychiatric hospitals, and other congregate care settings. Folks in those settings comprise less than 1% of the US population, but nearly 50% of coronavirus deaths. I think as those numbers belie, the pandemic has really tested all of us at all levels of government, at all, whether you be an advocate, a local government official or elected official, or, even just an activist working in your community. But I've been heartened by how tireless we have all been working at this issue. And, it's left me hesitant but hopeful as to the future. But I think this whole effort around non-congregate sheltering, around FEMA reimbursement, it creates those 2 larger questions that we'll explore during this webinar, which is how do we take advantage of these FEMA funds to ensure non-congregate sheltering is set up and sustained throughout as long as the need is there, and what do we do afterwards? I think those questions are very connected. Answering one question helps us answer the other. So we'll get started right away. Turning to you, Anne, while many jurisdictions have sought to implement non-congregate sheltering since the early days of the pandemic, President Biden's January executive order, which increased the reimbursement levels for non-congregate sheltering to 100%, really renewed, I think, a lot of interest in the model, at least from where we sit at NLIHC. Can you break down the steps needed to set up FEMA-reimbursed non-congregate sheltering program?
Hi, Noah. Hi, everybody who's out there. Nice to see your names show up in the attendees list. No, thank you for that question. And I'm going to start with saying that I had an opportunity after Hurricane Harvey to actually work with the city of Houston and Harris County. I sat in the George R. Brown Convention Center, which at its largest, I think, had close to 10,000 people in it. And we were able to use Category B, FEMA Category B funding to do some of the same work that folks are thinking about now. So I'm coming at this not just with my sort of national lens, but also having done some of this work locally. And the first thing I'm going to say really clearly and out loud is that every community should be using their FEMA dollars to support and serve people who are experiencing homelessness or who are at high risk through a non-congregate sheltering approach. it is hard for me to understand. I know the challenges that are associated with FEMA reimbursement and the concern that a lot of state and local communities had walking into this around the 25% cost share. But once that, as you mentioned, was sort of taken off the table, and we know that reimbursement is 100% for eligible expenses, I would just really encourage everybody who's on this call and all of our states and localities to take advantage of this funding that's available to provide services and non-congregate shelter for people who are experiencing homelessness and who are at risk of COVID-19. So to answer your question, the disaster declaration has already happened. It happened a year ago, and it's across the country. So the steps now are a little bit different than they would have been a year ago, but here's what I would suggest members of our audience do. There are a lot of materials available. Did I accidentally mute myself? I'm sorry. There are a lot of materials available on FEMA's website, and I would encourage folks to become familiar with those. I just put one in the chat that I think is particularly clear and helpful as you think about how to pursue standing up a non-congregate shelter program. What you need locally is a public health order. You need to have a request that provides FEMA with the information it needs to approve it, and you need to have a cost estimate in place. There's a couple of other things that I would just note as you think through how to set up a program. Usually these requests are made of FEMA through the state level. You can do it on their online application process is at grantee.fema.gov. That's grantee.fema.gov. You can do it that way if you're a locality, but it's really much more effective and efficient to go through your state emergency management office to ensure that everybody is sort of working towards the same goals. The other thing that's changed in addition to the cost share that we were just talking about requirements is that a year ago when we were having these conversations, FEMA was only approving non-congregate shelter for 30-day increments, and that is no longer the case. They have waived that requirement. So now you don't, while you do have to submit data, and I'll talk about that in just a minute, every 30 days, that you don't actually have to only plan for 30 days ahead. I mentioned that I did some work in Houston and Harris County after Hurricane Harvey, and I will tell you the most important thing that I did on behalf of the city was that I worked with our regional FEMA staff to make sure that I understood what costs were eligible, that I understood what data I needed to collect, and that I understood what a reimbursement process was and what they needed from us in that reimbursement process to make things sort of as smooth as possible. So the link that I shared really lays out for you what costs are eligible for reimbursement. So I would pay close attention to that. And really, it's largely leasing of non-congregate shelter sites. It is operating those sites, doing some security. The piece that's really not eligible for FEMA reimbursement are some of the supportive services, many of the supportive services that people experiencing homelessness need in order to be stable in those units. But what's important for you all to think about is how you can use these other either CARES Act or new resources coming through the American Rescue Plan Act that was passed last week to ensure that you have the funding that you need. Specifically, I would point to Emergency Solutions Grants, CV dollars, CDBG, CV dollars, or Coronavirus Relief Funds to provide the supportive service dollars that you might need in order to run a successful non-congregate shelter program. The other point that I made earlier, just to put a finer point on it, is to ensure that you have the right data. that you're collecting the right data up front on the individuals and households that you're serving through non-congregate shelter, but also that you are collecting the right financial documentation that needs to be submitted to your state or to FEMA in order to get a successful reimbursement and not have a huge delay in terms of reimbursement. Again, that link that I put into the chat does lay out some of the data requirements, but I would definitely check with your regional FEMA staff. And FEMA is actually set up regionally, so you want to talk with your regional staff to ensure that you understand what data you're going to have to submit in order to successfully get reimbursement. So does that do it, Noah?
I think so. I think so. I just add a caveat on there in terms of duplication of benefits
Yes.
with the utilization of additional federal funding. I call duplication of benefits FEMA kryptonite because it pretty much stops
Right.
stops the entire process cold. But that's easily circumvented, as you said, by like being in contact with your FEMA region, being in contact with emergency management staff. They'll know a lot more about that. But suffice to say, it's just to prevent double dipping, where you're using one type of federal funds and then being reimbursed for the spending of those federal funds by FEMA.
That's right.
But yeah, that's excellent. I did just kind of like moving on from the implementation, because I think that was an excellent description, and kind of like looking at the end game per se. How are there best practices out there about integrating these existing non-congregate sheltering or the non-congregate sheltering programs that folks are trying to set up? How does that dovetail with existing housing programs? Yeah.
So what I would say, I'm going to put another link in the chat. This is a link to a project that a number of national organizations that are included here today have been working on, called the Framework for an Equitable COVID-19 Homelessness Response. It has a lot of resources available to communities there, especially around shelter and working with people who are unsheltered. So I want to just note that. But I think it's really important for communities to try and balance two things. The need to plan for ramping down all the way through. You always have to have that sort of in the back of your mind as a person who's doing operations and program planning, but you also have to not let the fear of ramping down stop you as a community from doing the work that needs to be done to house folks in non-congregate shelter, doing the sort of having the political will to move this process forward to serve people who are in unsheltered locations right now. So I think that it's really about balancing those two things. I know that we're going to hear from some local folks who are doing a good job of having that balance. And sort of as you think through planning for a ramp down here, this is a little bit different, obviously, than past disasters or even like the Great Recession, right? In that things are changing so fast all the time that the way that we were thinking about something even 3 months ago is quite different than we might be thinking about it today with the passage of the rescue plan. So what I would encourage folks to start thinking about is, one, what does non-congregate shelter need to look like in the future? Because very clearly what this pandemic has pointed out to us, if we didn't already know it, although most of us already know it, is that congregate shelter is terrible for people. It's damaging to them, and people who have to use it don't like it. So to the extent that we can learn from this experience of doing non-congregate shelter and really reimagine the way that shelter systems work in the future is one thing that you need to have sort of in front of you as you do this planning. But also, how are you going to use all of these other funds that are coming down the pike in order to ensure that the humans that are in non-congregate shelter are not exited back to the street, and that you are ramping down in the most effective way possible? And that means using right now, I believe that the ESG COVID money nationally is only it's less than 10% expended. There's a lot of money still on the table there. How are you going to use those funds to get folks into units? How are you going to use your CDBG dollars and CRF dollars to get folks into units? I just had the opportunity to hear from the Treasury Department, new emergency rental assistance funds, which are largely for eviction prevention, but they can be used to exit people from homelessness or from non-congregate shelter if they have a lease. So, so folks can be exited using those funds as well. And then we also were successful in getting in this last package housing choice vouchers, $5 billion. That's about 65,000 vouchers nationwide. So communities should be looking at, planning for the interim, and then also when those vouchers become available for people who are experiencing homelessness or at high risk of homelessness, how are those going to be used as you're ramping down your non-congregate shelter COVID response? So all of these things have to be looked at sort of cohesively and planned out, but also leave yourself some room because things are changing fast.
For sure. Thanks so much. Great. I think that's excellent. I was also just going to say, I've been seeing a lot of more questions about like eligibility of FEMA reimbursements. So I wanted to ask if you had any kind of off the cuff, thoughts on how widely the eligibility is for non-congregate sheltering, or if it needs to be purposefully increased. I know it depends heavily on what the state's doing.
That's right.
In terms of what those conversations with their FEMA region looks like, but just any thoughts before we switch on over to Jason?
Yeah, I would just note, I think you're exactly right. You need to know what is in the public health declaration by your state or by your locality, because that in some way is going to determine eligibility for FEMA reimbursement. But I would also note that many people who are experiencing homelessness and are especially in unsheltered locations have high rates of the kinds of risk factors that make them very susceptible to COVID-19. And in most cases, folks are either they're at a certain age and above that make them at high risk of COVID-19, or they have certain types of underlying health conditions. Many people living on the streets have these kinds of underlying health conditions that would make them eligible for non-congregate shelter through FEMA. So I would look to two places. The document that I linked to has specific eligibility criteria, but two, and probably more importantly, you need to look at the public health declaration by your state or locality.
Great. Thanks so much, Olivia or Anne. Yeah, I think that's important. And again, it's just like underscoring collaboration with FEMA, collaboration with the emergency management folks, and just it underscores kind of the local approach, the state and local approach that a lot of places are going. I did see a question coming through the chat about best practices in terms of non-congregate sheltering. And as luck would have it, we have somebody to talk about one such best practice, which is what the state of California has been doing with non-congregate sheltering. They've been doing an excellent job, very quickly stood up. And, I think that's always we've been, at least at NLIHC, been holding that out as a goal in terms of what your ideal non-congregate sheltering system at the state level would look like. So I wanted to bring in Jason Elliott, who again is senior advisor to California Governor Gavin Newsom. So Jason, what was the key to rolling out Project Room Key, which is the non-congregate sheltering program over there in California? What was the key to rolling out that program so quickly after the pandemic's kind of initial spread into the state? Because it really was very quick and impressive.
Thanks, Noah. Hey, everybody, and good morning from out here in California. Good afternoon to those of you on the East Coast. Question, how do we get Project Roomkey going so quickly? And, I think the answer is something that Anne actually said, which is you can't be afraid of what comes next. You have to start. And to the extent that when this pandemic began, and it's always easy to look backwards and say, well, yes, of course, hotel motel leases make sense to shelter people experiencing homelessness and those vulnerable. But that hindsight is always much sharper focus. At the time, we made a lot of mistakes, frankly, when we started Project Roomkey. The first couple of hotels that we leased under Project Roomkey are 2 hotels by the Oakland Airport out there in Alameda County. The state leased both of those, and we controlled the service contracts. We had a lot more direct hands-on in that hotel. That model did not work. So instead of sort of insisting on keeping going in that direction, we got together with a bunch of our local partners and we pivoted the program. And now the way that Project Roomkey works in California, and each state is going to have a different emergency management structure, but in California, the local governments implement the model, and then we help them submit that reimbursement to FEMA, but it's really locally implemented. They identify the hotels. They identify the clients through their coordinated entry systems and their existing networks. The locals contract for the service providers, and it's been a wildly successful model. And I don't actually think, and this is not false humility, I don't think the success of Roomkey is because of the state. I think the success of Roomkey is because of the hundreds and hundreds of community partners that we have implementing this thing. And the fact that only once in a while do we hear a very traumatic or terrible story about something happening in a hotel, I think is the proof point that largely local governments are so community connected. They have those deep relationships with service providers. That's really where the on the ground work should take place. So at Project Roomkey ramped up, and we were at a plateau, steady state for a while, and unfortunately it started to ramp down. We can talk about that in a second. At peak, we had about 17,000 hotel rooms working in the program, over a few hundred hotels. The Department of Social Services, California Department of Social Services, led by Kim Johnson here in California, is really the lead organization inside our government that's implementing this. And they report that we've served 35,500 people, at least, people experiencing homelessness during the pandemic. Look, we all know pit counts, so I'm not going to pretend, but our pit count is 108,000 unsheltered. So 35,500 is about a third of that pit count. Now, all of the caveats and asterisks that go on that, which people on this call don't need any explainer on, but just to give you a sense of order of magnitude of what the local governments have been able to accomplish through Project Roomkey. So obviously, as many around the country are thinking, we want to see this not only level out, we don't want to see communities disenroll hotels. We actually want to see it ramp back up. We, along with NLIHC and NAEH and a number of other organizations, lobbied really hard for some of that FEMA, both retro and forward, the 100%, not having to recertify every 30 days. There's a lot, and I'm sure a number of the 400 people on this call were also part of that advocacy coalition. So a collective round of applause to those of us, and to those of you, I should say, who worked on getting that done. But it is done. And I think now every day that goes by that we don't either maintain the hotel portfolio we have or sign up more hotels is a massive wasted opportunity. And the urgency that we feel in California, it's every morning, what can we do to get more hotels into the program? This pandemic is not over, and this pandemic is not over for the people that are most vulnerable. And largely, knock on every piece of wood in my entire office, we have been able to control some of the worst ravages of coronavirus on this population. Just to give a sense, our modeling very early in the pandemic, 108,000 unsheltered, 56% attack rate, 40% high risk within that. Multiply, you're looking at 25,000 people experiencing homelessness that are potentially going to die from the coronavirus. That was our early modeling, just in California. We haven't seen anywhere near that. And of course, every loss of life is tragic in its own right, but in aggregate, we have not experienced the loss of life in the homeless population that we feared. That is for a lot of reasons. One of them, a big one, is non-congregate sheltering. So, I think that every day that goes by, and today is March 16th, well, we can help somebody on March 17th, but that means we have to act now. And we can help somebody on March 18th, but that means we have to act tomorrow. And it's just September 30th is a long way away. And we are going to have a problem. We're all going to have a problem when the NCS reimbursement ends, be it in September or be it whenever it is. But that's a problem. I'd rather have that problem than the problem of massive outbreaks in encampments and our health system being overwhelmed and the tragic loss of life. I'd much rather, if you're going to force me to pick a problem, I'd much rather have the problem of rehousing tens of thousands of people in a quick amount of time. In California, we did something called Home Key, which is we actually bought a bunch of these hotels, and we're starting to move people into those as a interim or permanent housing sort of situation. So there are solutions out there. But if we wait and hand wring about what happens at the end, we're never going to get started. And that means that person that we could protect tomorrow is not going to get our protection, and they deserve better, and we have to do better. So I think we're really pushing, we continue to push our local governments to implement Project Room Key as quickly as possible. And we're not going to take our foot off the gas there. As Ann was talking, and Noah, you mentioned this, I saw a lot of questions in the chitter chatter there about what's eligible and not eligible, and shared a really good resource. I also shared the CDSS website, which is just a treasure trove of FEMA documents and super readable, kind of plain English eligibility stuff and step-by-steps on how to set up a program. So in addition to what Ann sent, take a look at that DSS document, which I'm sure Noah can circulate to the attendees after this. It's just a really rich resource. And there it is. I see it just pop in the chat again. So take a look at that. There's a lot of information there. I think maybe I'll pause there and ask Noah if there's anything else you wanted me to discuss.
Yeah, for sure. And thanks for that. Yeah, I think the word it's courage, especially on the part of local governments and local government officials, to kind of take that step. And I think it requires it to do something so new, but something so, something that is a best practice, but something that is so new, especially during like a time of upheaval, like a pandemic. But I think, I think we need more of that attitude in terms of folks on the ground, and more of a stance of like, well, how do we do this? Let's pick what problem let's pick the easier problem to solve, which is the rehousing aspect of that.
Yeah, I talk about it in terms of problems of success and problems of failure. A problem of failure is that we have massive outbreaks of COVID in encampments and shelters. And a problem of success is, well, we've just brought 35,000 people inside. How are we going to help those individuals transition to more stable lives? That's a problem of success, and I'll take problems of success every day.
Yeah.
Amen.
Yeah, amen to that. So you mentioned about kind of transitioning folks into permanent housing and permanent supportive housing. What's the plan in terms of Project Home Key and Project Room Key in doing that, and especially in terms of with an eye towards accessibility and in terms of additional services provided?
Sure. So I am so happy to be on this panel where I can use jargon and shorthand my answer to this, because every single journalist that I talk to about this and every single other panel I do, I have to sort of explain some of the context here. But one of the questions we get is, great job. You've put 35,000 people through Room Key. Where are your 35,000 units of permanent housing? And that's not the way that works, right? And I think what we're trying to do is look at Home Key, which is our version of new of acquisition rehab of permanent housing, as just a gap filler in a broader system. Look, we need more vouchers. We need more housing navigators. We need more of that. Obviously, the Biden proposal around universal vouchers is a game changer on the scale of Social Security and the WPA. So let's focus on that together. Of course, Home Key fulfills a need for additional permanent housing exits. Some permanent supportive, some permanent interim, meaning we own them permanently, but they will fulfill an interim housing capacity if a continuum needs that. But of course, we also have across the country, but I'll speak to California, a need for more service-enriched housing, right? That a converted Motel 6 is actually not going to necessarily work for everyone who's coming through Room Key. And those who have more acute, either permanent disabilities or more acute behavioral health issues or dealing with acute substance use, that's a different kind of physical housing that we need. So our proposal next year, so last year we did Home Key. Home Key, just for order of magnitude, brought online in 6 months. We brought about 6,060 units, just over 6,000 units of permanent housing in 6 months at about $150,000 a door. So that's scale. That was 850 million. That was last year. Now we're proposing 1.75 billion in state general fund to do more traditional home key, which is funny. Traditional home key. Home key didn't exist 8 months ago, but now we're talking about traditional home key. So traditional home key, but then we're also proposing $1 billion for acquisition of what in California we have board and care facilities, long-term care facilities, whatever they may be called in your community, to provide exits out of homelessness, but exits out of room key into more service enriched housing so that people can be successful. Because we all know that if you take someone with really acute needs and try to put them in a motel room behind a closed door with not a lot of support, that's not going to be a successful exit. So we have to invest in all phases of the continuum of exits, not just from room key. Room key is shelter, right? So let's not give it more credit than it deserves. Room key is shelter. And from shelter, we need to navigate people to housing. But shelter is better than unsheltered, right? And especially in a non-congregate situation. So as we're moving people through the continuum, let's make sure that we're investing as California and as the country in all phases of that sort of housing for all framework, meaning prevention and vouchers and rapid rehousing all the way through this service enriched housing, which in California really looks like buying board and care facilities and other kinds of long-term care facilities and everything in between. So 35,000 deduped shelter people in California is great, but that's a third of our population. And 6,000 units of new housing is great, and it's not going to dig us out of the homeless crisis, right? So this is it's meant to say that these are models that work. Obviously, the rescue plan had the $5 billion that explicitly made available for acquisition and rehabilitation of housing for PEH. So that's good, right? That the conversation's moving in that direction. In California, faster, cheaper than we can do new construction. I mean, bar none. You're talking about 5x faster and 3x cheaper, right? So these are sort of paradigm shifting kind of models. And now we have something that's working. We want to just pour gas on it and just get as much housing in the pipeline as possible. So that's kind of the exit philosophy.
Great. I think that sounds excellent. Yeah. It's working.
Write your checks to the state of California if you like what
there
we're
you
doing,
go.
Yeah.
There you go, for sure. Well, thanks, Jason. I appreciate that. That makes me feel optimistic generally, which I appreciate, especially during these times. But kind of rolling along with additional services, I wanted to bring in Jermon and Shaylin over at the Partnership for Inclusive Disaster Strategies. So as I said at the beginning, folks with disabilities have been exceptionally hard hit by this pandemic. They're hard hit by, all disasters in terms of the danger to their lives, the disruption, to their daily life that those things cause, that those disasters cause. And I know that, there's a trend towards institutionalization of folks living with disabilities during disasters, which is not the way to do it. But I think during pandemics, it's like even more so not the way to go about doing this. So I wanted to have you all talk about, non-congregate sheltering does present a lifeline for many folks that are trying to leave that kind of congregate care facility. What do they need to access non-congregate sheltering safely? Like what are the roadblocks there to allowing folks with disability allowing folks with disabilities to fully utilize that model?
Well, hi, everyone. My name is Shaylin Sluzales, and alongside me is Herman Parodi, and we are the co-executive directors of the Partnership for Inclusive Disaster Strategies, which is the one and only national disability-led organization, meaning we are led by, for, and with people with disabilities, and we are solely focused on the rights and needs of people with disabilities and people with access and functional needs before, during, and after disasters and emergencies. And that includes this public health emergency as well. As Noah was saying, saying in disasters, people with disabilities are 2 to 4 times more likely to die or be injured in a disaster. And this comes from the United Nations. And this is largely due to the lack of resources and access to resources that people with disabilities often are left behind and fall through the gaps when it comes to disaster response and responding to disasters in that immediacy. We've seen that COVID-19 pandemic is no different, as we've been seeing it ravishing nursing facilities across the nation, first notably in Washington State at the Kirkland Nursing Facility. As I mentioned, institutionalization always happens in disasters, and people always die, people with disabilities first, and are always the last to be thought of and remembered in these times. We are seeing this with the COVID-19 pandemic, that 34% of all the COVID deaths have been people who live and work in nursing facilities. In other words, over 174,000 people have been people with disabilities dying from this pandemic. We see this time and time again throughout disasters, and I'm going to put some resources in the chat that sort of highlights this, that in nursing facilities and during disasters, when folks are evacuated from a nursing facility, oftentimes we think maybe they go to a shelter, but that is not the case. We take folks from nursing facilities to another nursing facility in terms of evacuation. And we know that prior to the pandemic, nursing facilities were not a safe place. They are no home. They're not a home when you don't have a choice to wake up in the morning when you choose to wake up, what you want to eat in the morning, and when your rights are stripped away from you and the nursing facility owns all of your belongings. That is not what we call a home. And one of the biggest systemic issues that we're seeing when trying to utilize non-congregate sheltering to get people out of these deathly facilities, nursing facilities, and out into safe cohort settings like hotels, motels, and dormitories, that the largest systemic barrier is that people in nursing facilities are not considered homeless. And funny enough, just all the things I mentioned, that's not a home, right? So we as advocates are saying, hey, people that are in nursing facilities, that are in other types of institutions, they are not in homes, they are homeless. They should be considered homeless so that then we can get them out more easily through all of these other types of services and programs that our colleagues have been mentioning today, and that the National Low-Income Housing Coalition and many others throughout the nation and states and localities have been working through homeless populations. We've been seeing a lot of great, good and promising practices come out, but we're not seeing similar responses to getting people out of these deathly nursing facilities and congregate settings, institutional settings. A year ago, when the COVID-19 pandemic hit the United States, we at the partnership brought together partners from across the nation on February 28th of last year to draft a call to action that really addressed the urgent needs to address for a whole government approach to respond to this pandemic, and the gaps that we knew were to come, and the priorities that we knew were going to be left behind for people with disabilities. We've been meeting each and every day since that call to action, and I mean each and every day, weekends, holidays, all of the days. And we have, since now that we've been meeting for over a year and counting, we put out another call to action a year later that really highlights that not much has changed for people with disabilities throughout this pandemic, and in fact has gotten worse since our original call to action. We also have many great resources around COVID-19 and the institutionalization of people with disabilities, and I will get these resources in the chat in a moment for folks, but just really wanted to highlight that one of the big things that we are seeing is a lack of governments identifying the COVID-19 infection prevention as a priority in congregate institutional settings like nursing facilities, like long-term care facilities and group homes, those types of institutional settings. We really need a call for governors and state leaders and local leaders to take the lead and say that we can mitigate this disaster in these institutional settings where the majority of people are dying from COVID-19 by offering a relocation to non-congregate shelters like hotels, motels, dormitories for people who want it, just offering it and seeing who wants to take up the offer and get out of there and be placed into a temporary setting in a hotel, motel, dormitory with the services and supports needed to support them in those settings. And we know that there's very great resources out there that support people with disabilities in hotels, motels, dormitories. We have great examples happening throughout Pennsylvania, specifically in Williamsport, Pennsylvania, at the Roads to Freedom Center for Independent Living, in Colorado at the Atlantis Community for Center for Independent Living, and in Illinois, Chicago as well, where folks are getting to people that are in these facilities saying, hey, we have connections with our localities to get people who want to be supported in a cohort hotel, motel, dormitory setting with services and supports. Actually, I will note more services and supports than they actually receive in the nursing facility, as it's a misconception that people receive 24/7 care in a nursing facility. That is not true. Most times people get about, on average, 2 to 3 hours of direct hand-on care, and that is when the staffer chooses to meet that person's needs. So you could have an accident in your bed at 10 a.m. and you don't get that resolved and cleaned up till 3 in the afternoon, depending, maybe. And there's also a lot of abuse and neglect that is ongoing systemic issues in nursing facilities. So these have been no place for people to go, and certainly now with the pandemic has shown the spotlight of how deadly these facilities are.
Great. Yeah, I think amen to that. And I'd just like to, to shout out the work that the partnership has been doing. Those calls truly do meet every day. I just feel my phone buzz at 4 p.m. on a Sunday, and I know it's y'all sending out the Zoom link for the daily call, and as well, I know y'all were meeting even as early as January about these January of last year about pandemic issues and anticipating what the needs will be and things like that. So it's been very impressive to see you work, and it's been a privilege to be a part of your work. Kind of going along with that, actually, what are ways that collaboration could exist between the disability rights field and, the housers writ large, homeless service providers and things like that? Just because since we are pushing for the same, kind of solution, it makes sense to me that there's a united front in support of that goal.
This is Shaylin, and I would say first and foremost is reach out to your local Center for Independent Living. Reach out to any local disability-led organization and collaborate with them on these types of solutions to address these needs, because we are working on them, and I know folks are really excited to collaborate with others. I'm also noticing right now I'm putting some resources in the chat, but they're only going to panelists, so I will get them out to everyone in a moment as well.
Cool. I'll ask my partner in crime, Elena, to do that as well.
Thanks.
Yeah, we'll get a listing of the chat once I close this event, and we'll make sure we'll make sure to share the materials, the contact info of all the panelists, as well as the recording when it's available. Cool. So moving along. Thank you so much, Jamana Shaylin. I appreciate your work as always. So moving right along to you, Joy, who's director of the Homeless Research Institute at the National Alliance to End Homelessness. I know that, so we've talked about California, we've talked about some great work that Centers for Independent Living are doing across the country. I know that in addition to California, there's been some non-congregate sheltering set up that you've been able to see in terms of the research that y'all are conducting over at NAEH. How prevalent has non-congregate sheltering been so far? How many providers have been able to implement this?
Sure. So I should say a little bit about our source of information. When the crisis first struck, we were very interested in of course, of how it's impacting people experiencing homelessness and how COCs were able to respond. So we began a series of surveys. We did one in April of 2020, July and November. And we basically sent our survey instrument out to various COC leaders across the country and have asked them an evolving set of questions over time. And essentially what we found is that most of them were implementing hotel motel programs. From the very beginning, from the first survey in April, 83% of them had procured some sort of rooms. They were more so, a little bit more likely to reach the people who were already sheltered than unsheltered, but they were reaching both groups. As we continued to conduct the surveys over time, we saw that some of them were increasing their number of rooms, and that they were able to serve more people. But we did note in our last report that the number of people being reached has been small, relatively small. At the beginning, we were asking for specific numbers, and we were seeing that basically they were reaching about 2 to 3% of their service population. As time went on, we looked at a couple case studies, and we saw that a couple of them maybe had gotten up to, by the time we got to November, 9% of their population, 20% one of them. So, but there was no COC that we found that has been serving even most of their population, over 50% of their population in non-congregate shelter. This has been a concern for us because we've looked at a lot of the research that was available. Admittedly, it's not that much, but there were the CDC studies that were published very early in the crisis that suggested that within congregate shelters, the virus could spread very quickly. I would suggest monitoring the National Healthcare for the Homeless dashboards. You can easily find them on their front page, and I can post those in the chat as well. But they regularly update their numbers related to number of cases they found through their centers, but also through testing events. And those testing events are very revealing, where again, they demonstrate the places where the virus has been introduced, it could spread very widely. Another interesting source of information was a University of Washington study focused on King County. They specifically wanted to test the model of using hotels and motels. So they compared people in those programs to those who were in congregate shelter, and found that the hotel motel residents were much less likely to contract COVID-19 through subsequent waves of the virus. So all of these things point to us, say to us that it would be better to get more people into the congregate shelter, and we would like to see those numbers that we saw increase. I will say that we became concerned at the end of last year because we had started seeing the news reports about cities considering shutting down their programs. So we did ask that question back in November, are you considering shutting down a program? At that time, most of them were not. I think it's interesting that Jason said that in California, some of them are ramping down. But as of November of last year, we found that most had not closed them, but that they were still operating. It seemed to be some issues. One of the issues that was cited was funding. So we knew that some people were using FEMA funds, but others were using their CARES Act funds for that, to pay for those programs. And then there seems to be a fair amount of NIMBY issues too. Places where people had been placed in hotels, and over the course of the program, there were a lot of complaints from neighbors or neighboring businesses or what have you, and they're trying to get the people out. And so that is a real issue and one that we're concerned about.
Yeah, I saw Andrea Nika nodding her head vigorously at the NIMBY issue. So, but we'll get to that in just a hot second. But thank you for that, and thank you for doing that research. That's always super helpful to see. It's been, I think, difficult to especially because this program is so new, to like find good data on this stuff. So I wanted to ask, is there any type of info that we're not collecting that we should be telling folks to collect? Is even with an eye towards measuring outcomes at the end of it, because I think a big issue that I have with a lot of disaster recovery programs is that they don't measure outcomes. So, oftentimes we don't know like how well, a certain FEMA program or a certain thing actually ended up being for disaster survivors. How should we be measuring outcome for non-congregate children?
Well, I think a big outcome measure is how many people were served. I just have to say it, how many people were served, because I think it's important how many people were able to be in non-congregate. That suggests that they were in a situation that was relatively better for their health, and would help prevent the spread of the virus. So knowing how many hotel rooms there are, how many people were in them is useful. And to be quite honest, we don't have that on a national level at this point. The COCs know those numbers. And if you are not working with a COC, but in a related capacity, you can ask, you can request that information. At some point, HUD may give us a better idea of what those numbers have looked like, but we don't know for sure on the national level. And I should say that probably by this time next year, they should be doing some reporting about the number of beds that were in their different programs at the beginning of this year. So that's going to be helpful, but much delayed. So yes, one thing that's helpful is just to know how many beds you had, how many beds there were, how many people were served. That has to, at this point, come from the localities, or if the states want to share that information, and the delay from the federal government. The other thing I think that is useful to know is I've seen some effort to find out other well-being factors. That might be something that's useful to know. People, at least in the University of Washington study, reported all kinds of positive benefits to their mental health, to their sense of stability, sense of well-being, just by being in the non-congregate shelter. You can imagine, this is probably common sense things, that people who are homeless feel better when they are not in large shelters or are living outside, when they have their own space, their own bathrooms, their own a greater sense of autonomy. That worked well for a lot of people, and it's humanizing, really. So you might want to measure those types of things as well. Yeah, I think those are big ones. And if we got to that point, we would be doing well, because we are suffering from a dearth of data and information, quite frankly.
Well, thank you so much, Joy. Informative as always. I appreciate your work, and giving us some more situational awareness in terms of the advocacies, the policies that we're pushing here, with us at NLIHC, NAEH, NLC, and all the folks online. So appreciate you. So kind of moving into the idea that a lot of places are not utilizing non-congregate sheltering as much as they should be, given the positive health outcomes that we've seen. I wanted to bring in Andrea Nika Morris, who's executive director at Housing New Orleans, Housing NOLA. And Andrea, you've been involved with local efforts to push for non-congregate sheltering for the city's unhoused population. I think we as advocates have done a good job raising the awareness of the issue, but I think we're kind of running into like closing issues. How do we close the deal on it? What's the opposition that you've been seeing at your local level, and kind of, do you have any idea why this practice isn't as widespread as it should be?
So yeah, good afternoon, Noah. Thanks for hosting this. This is an amazing conversation. I am really glad to the way you guys designed this, explaining the information, and I'm here, unfortunately, to talk about the bad news, right? The fact that we've got this this absolutely executable, absolutely needed, making the case program protocol that is sitting on the shelf in too much of the country. And like often with the modern disaster era, we are here in Louisiana to lead the way in the bad ways. Unfortunately, New Orleans and the state of Louisiana last year actually stood up what I think is an outstanding model for this kind of program, where they brought online 400 hotel rooms over a string of hotels that were anchored with medical care, 24-hour medical care, that were anchored with food programs, that were anchored with supportive services. And the biggest complaint I have about the program is that they didn't expand it to meet the needs. Our numbers are nowhere near as dire as what we're seeing in California. Our point in time count for 2019 was a little under 1,200 individuals. So bringing online 400 hotel rooms, again, seeing that same third kind of be across the board, it speaks to a larger problem, in my opinion, and it is the unwillingness to do what's necessary. And it's why it's important that of housing advocates and homeless continuums of care, we have to come together. For too long, this work has been bifurcated, and that's changed a lot in the last decade. But I've been in this work for a long time, and I remember when homelessness was over here and affordable housing was over here, as if those two things aren't absolutely linked. And why in places like New Orleans in particular, our homelessness rate is not going down because of the affordable housing crisis, because people are being evicted. More and more people are being evicted in New Orleans pre-COVID because they could not afford their rent or their mortgage, and they're losing their housing and becoming homeless. So the root of this is the thing that we all get up to work around every day, is the failure to recognize that we need our policymakers to put housing first, to promote a housing guarantee. But it is startling, right? In the middle of this pandemic, where you see there's not a mayor, governor, a senior level policymaker who didn't say the word shelter at home in the last 12 months. And the fact that we are still having this conversation speaks to how deeply rooted the bias is around housing. We have a lot of work to do. We knew it before COVID. This is the proof, right? That this, because it's obvious to us, and we're having what are incredibly frustrating conversations with policymakers about money. And there you can have the very logical, straightforward argument about the fact what it costs. Jason laid it out very clearly, what it costs in terms of human life, what it costs to the system to leave these folks on the street. And we're choosing to do that rather than meeting this need. And it continues to be exacerbated here in the South with the polar vortex, that we did not also say, okay, we can't leave everybody on the street during this polar vortex, because this is Southeast Louisiana and nothing here is built for below 20 degrees. We're not built for this, boys and girls. So these folks cannot be outside. And that we opened up our traditional shelters in the middle of a global pandemic, a communicable disease that is ravaging this country still, and said, instead of opening vacant hotels. And so the bad news is that this is good old-fashioned anti-housing bias. The good news is that we know how to fight that. The bad news, again, though, is that we should be farther along. This should not be this hard. So we've got to band together, and we have to continue to talk to people. We've been having some success with moving the needle and standing up to our elected officials and policymakers and saying what you're doing, what you're proposing isn't good enough, period. And actually not letting those conversations slide when someone says that, oh, well, what's going to happen in September when they don't have any housing and this program is over? What'll happen in September if we leave them on the street? This is not stop settling for the 10-word answers is the big thing that I have to say to everybody. When someone says something stupid like that, you have to, sitting in the room as the advocate, go, did you just hear yourself? Because I heard you. And what you just said is deeply problematic. Engaging with the media. This is again, we think we have media partners who understand housing guarantee, we understand housing as a human right, understand put housing first. But when you start talking about these issues, you pick at the underlying bias, right? And again, we've also got to talk about the fact that this is a deeply racialized bias. It's Black Lives Matter unless you're homeless. Black Lives Matter unless you're a renter. Black Lives Matter unless you want to come live next to me. And again, the Black Lives Matter movement, and we've been able to work with this here in Louisiana, where Black Voters Matter and a number of these other groups who are on the forefront of these issues are supporting the put housing first concept and using that to say, number one, what do you need to be a voter? You need an address. You need to make sure you need that's the first thing that you need. You need an actual address, because where you live determines who you vote for. And so we can't continue to ignore these needs and shy away from these bad faith arguments. That's what the big problem is, unfortunately, in my opinion. I've had several conversations about this where I've seen emails from local officials shared with reporters where we actually have one partner where we launched this programs in various forms under COVID, since COVID happened or rolled through Louisiana last year, and they have stopped allowing new people to be added because of money, because they haven't gotten the reimbursement yet. And this is unacceptable. It is frankly unacceptable. I saw an email the other day where one of our partners, where a comment was made that the Lafayette program has more people in it than New Orleans. And the argument was, well, New Orleans has more homeless people, so your program shouldn't be bigger. That's not the argument. The argument is, why isn't New Orleans' programs meeting the needs of every single homeless person? And why should that constrain the program in Lafayette? That you're a public official, you're not meeting the needs. So the people in Lafayette should stay on the street because we don't have a robust program in New Orleans? Again, do you hear yourself when you speak? Did you hear what you just said? And this is an email that someone wrote to a member of the media. And the reporter responded, asked me, what did I think about this? I got to take a minute to process this kind of nonsense. So that is the big problem, Noah. That's the issue. It's the same old thing that we get up to work on every day. We got to acknowledge it, we got to own it, and we have got to demand better.
Yeah, for sure. And amen to that in terms of like rural, urban, like issues like that. You're like, yeah, yes. And we can do both. So it's like a rural area doing a good job isn't a reason to
shut their program down and to
say
New
exactly.
Orleans should be doing better. I'm sorry. And we do have some good ideas. We've got what our folks are doing in Lafayette. I love the program that the state and the city stood up last year. They just didn't have enough rooms available. And we're working with National Income Housing Coalition. We did a pilot program ourselves, because we also think that there's a piece that's not often talked about. And again, it's something that us as affordable housing advocates might not necessarily be comfortable with, but we want to talk about hotel rooms, absolutely, but also short-term rentals, because there are too many homeless families. And while individuals being in a hotel room, that's absolutely is a game changer. a family with 2 children, 3 children, small children, larger families inside of multiple hotel rooms is less than optimal. And what we piloted with the help of National Income Housing Coalition was a very small program where we got short-term rental operators to house homeless families, because families need to be inside of, you know, apartments or empty houses. And the same things that make a hotel room ideal, because a homeless person doesn't have furniture, you got privacy and things like that. That also makes a short-term rental ideal as a temporary housing solution for families. And it's the same logic. The hotels are empty, the short-term rentals are empty because tourism has fallen off. And again, there's a win-win here for the short-term rental operators and the hoteliers who do not want. We don't need all your hotel rooms. California does, but in Louisiana, we don't need all of our hotel rooms. This is a tourism state. And again, we've seen this again when you know it's the same nonsense, the same bias around affordable housing, that same prejudice, because this is Louisiana. Guess what happened last year? We had 2 hurricanes roll through Lake Charles. Over the summer, every hotel room in New Orleans was bursting at the seams with evacuees from Lake Charles, over 12,000 souls. We know how to do this. This is not new to us. This is what happens in the Gulf states when a disaster rolls through. The disaster this time is a pandemic. So the response shouldn't be any different. And those are this is not some weird program. It is absolutely what we need to be doing. And we would also urge, we want to see it adopted, not just for traditional street homeless, but people who are housing insecure. Anne talked about that earlier, about what's available and how you can make the definition, and the formerly incarcerated who have been released without a housing plan. We also think that you should be, and that also for us is a source of funding for some of the funds that need to be reimbursed. We have the Justice Reinvestment Initiative, where we are instituting cost savings here in Louisiana by releasing more people and having cost savings that could be used to secure hotels and short-term rentals for that population to be reimbursed, right? So number one, it's savings. So rather than putting it in the general fund, use it and know that you're going to be reimbursed 100%. It should actually be a part of any release plan from prison, given what's happening in our prisons and COVID. We should be releasing everyone to hotels so that they can quarantine, even if they have family that they can go to. What has happened with this executive order is we have all the tools necessary to solve. And I think part of the hesitation, a reporter asked me to say, well, Andrenica, it sounds like you're trying to fool around and end housing insecurity and end homelessness on the backs of COVID. You're correct. That is in fact what I'm trying to do here.
We'll take it.
Yeah, I'm not pretending not to do anything else. But you might want to ask the next public official you speak to, why don't they want to fool around and end homelessness on the back of COVID? Why isn't that something that they want to do?
I think that sounds like a great meme, great hashtag, and I encourage folks to ask those same questions. So we have like 12 minutes, and I'm sorry, that's my dog Pepper barking whining in the background. So we have 12 minutes or so. No, 12. We have more than 12 minutes. We have some time for questions. So I wanted to ask, and I saw a couple comments about this, and I know I've received several questions in NLIHC's programming, tiny homes. Like, does that, how does that kind of fit into these non-congregate sheltering efforts? Have you seen folks use them in a FEMA reimbursable way or as an alternative to hotel rooms?
Maybe I can start with that one. So we do believe that tiny homes would be reimbursable under the non-congregate shelter model. We have not in California utilized them under Project Roomkey, which is the leasing, because we have ample supply. We have had up to this point ample supply of motels, which are just better suited than tiny homes because of the ability to do the custodial and central plant for some of the stuff. On Homekey, which is the buying, we are funding local governments to buy tiny homes and construct tiny homes for the permanent exits out of homelessness. So we think tiny homes, there are a bunch of California-based companies that are building tiny homes. You know, we call them ADUs out here, accessory dwelling units. It's the same thing. And there are a bunch of California companies that are doing that. We are very actively pursuing those with a bunch of mayors in California as part of the home key model. If communities are constrained in terms of motels, which if you're dealing with hurricane response or whatever, vacant multifamily has also been something that's been worthwhile for us even more than tiny homes, just because you can centralize a lot of those operations. But frankly, motels are best. And then I would sort of go down the waterfall after that, and then take a look at tiny homes in terms of pretty cost effective per unit. And just, you know, one thing we've been really sensitive is AFN stuff in hotels is not always there, especially if they're older motels. But you really are able with tiny homes, especially if you're building them new, obviously you can meet and exceed all ADA codes. So there's an opportunity there as you think about a portfolio. One of the challenges we ran into early in the pandemic was a number of the hotels we wanted to lease for Project Roomkey did not have functional access, the necessary access, not just to meet code, but in fact to serve the population. So maybe they met code, but really wasn't well suited for our population. So instead of not getting that hotel, we looked at a portfolio approach to try to move as many people as possible inside, including using tiny homes and vacant multifamily, where you can provide some more of that access. So just to share that.
Thanks, Jason. Anybody else on tiny homes? So kind of going down, I'm looking through our Q&A, and I also just wanted to shout out, you know, if we don't get to your question, I have your question, and we'll incorporate that into future documents and future conversations at NLIHC. I also facilitate the weekly Working with FEMA working group, where it's all non-congregate sheltering all the time, as well as additional disaster recovery topics. So, you know, feel free to join that and, you know, ask me the same question there. And I'm also always available via email. It's my job to answer your questions on that stuff. But moving right along, we've heard that FEMA, so in some places I've actually seen that FEMA has been saying that they should be the federal funding of last resort. But in other locations, you know, it's been like utilize FEMA reimbursements first. At least I think I saw some HUD documentation attesting to that. You know, where has FEMA reimbursements come through in terms of like the timing wise of the whole life of non-congregate sheltering overall? Does anybody have any experience with that?
I can start, and I think that probably our folks at the local level have better information on this. But you know, I saw that question and I started to look through all of the documents on the FEMA website, and I didn't see any language about this sort of funding of last resort. And it's not something that I have heard personally, but what I see is that FEMA does not intend for their funded non-congregate shelters to be the only solution for sheltering, but rather one of many forms of congregate and non-congregate sheltering assistance, and that you have to demonstrate that there's a disaster-related need. So I think you know, there's some gray area there, and also probably some regional interpretation that's happening at FEMA that is worth exploring. But I'd like to hear what our local folks, what their experience is.
Andrew.
So no, I wanted to clarify your question. You mean how long does it take to get the reimbursement through, or
more like
what's the process? And yeah, like
more like, would you use? So I think that in the context, it's a couple states have been saying, oh, like we'll only, you know, facilitate your application for FEMA reimbursement after you've used, you know, all your ESG funding up, or, you know, kind of like where along the line, is FEMA reimbursements, are FEMA reimbursements best utilized, I guess, since
Gotcha.
you can't duplicate the benefits.
That's right. Well, I mean, we haven't seen that problem here. It's not been because, you know, this crisis, this particular crisis is so extreme, right? There's not enough money from CARES Act to second stimulus to the American Rescue Plan. There's just not been enough money to meet all of these needs. So we haven't seen that yet. Where there's been most of the issues have been, again, it's ideological and an unwillingness to commit the resources. And I mean, one of the things that we have going on right now, no exaggeration, the state and the city are pointing fingers at each other saying, and then yesterday the COC got involved. The city said, oh, the COC can do it. Unless this has changed dramatically. No, the COC cannot initiate this. This is a FEMA program. You guys have to, our state Office of Homeland Security has to be involved. I mean, this is not unknowable. This is Louisiana. This is the birthplace of the modern disaster era. We know how to run FEMA money. It's not that complicated. For other places that have not been blessed with this many disasters, it may seem daunting. It may seem complicated. This is a government at its best and at its worst. I know one of the concerns that we have been having is where the money, the initial funds, and again, this hesitancy to invest in housing. This is where it comes back to bite everyone. If you don't have a housing trust fund, if because that's the money you would want to front and then have it come back. There are challenges if all you use are pass through federal dollars. You're not supposed to, you can, but it's difficult to do that. And but again, given what's happening, given the needs, we've got to argue and say, I need you to spend these tax resources on this, and you're going to get it back. So no mas.
Gotcha. Well, thanks.
I can say that our surveys revealed that some COCs were getting FEMA money early in the crisis. I know that as an organization, we received a lot of questions and a lot of requests for technical assistance, and we did a series of webinars and publications to help with that, and we saw more COCs in our later surveys reporting usage of FEMA funds. But so I guess I would just say that it's clear that for the early users, it wasn't a last resort type of situation because they did it almost from the beginning. But I think all of us know, and we can all see that there's some variation across the country about what's happening, depending on the region.
For sure. So I've been seeing a few comments on down the line, and thanks, Anne, for taking on some of that. Especially agree with the best practice of applying, submitting reimbursements every 60 days. I wanted to ask, Jason, has California received reimbursements back from FEMA yet?
We have. I was just trying to dig up the sheet for how much of what has been submitted has been reimbursed. I can't unfortunately find it. I was just trying to look for it. The answer is yes, we have, and more actually directly to the point, the local governments have, because as I mentioned before, we're effectively an aggregator. And I know there's a conversation here, and I know Anne is familiar with this, around LA feeling a cash crunch. And certainly we understand that that's a very real pressure. Obviously local governments across the country are dealing with operating deficits. A couple things I would say to that. Number one, American Rescue Plan is here, and that money is going to start to hit. And number two, one of the issues we've seen, especially in the smaller jurisdictions, and to those of you who are either in a smaller jurisdiction, or I guess I'm speaking more directly to any state leaders out there, the small locals are having trouble even getting their project worksheets together. And if you can't even get the paperwork in, then you're definitely not going to get reimbursed. That's not limited to the small jurisdictions, interestingly enough. A lot of the documentation requirements on NCS are pretty onerous, but the reward is quite large if you can cross the T's and dot the I's, meaning especially at 100%. So our Office of Emergency Services, which is the governor's sort of umbrella EM over the state, has done a lot of technical assistance with local governments and local EMs to try to get this paperwork in order. So to the extent that there are any other sort of state counterparts or big cities that are looking for any advice, we have, just as it happens, we have a guy named Ryan Burris, who maybe Andrea Nacina knows, who worked in New Orleans post-Katrina, who's with us now, and he's sort of our FEMA expert, and he helps us think through some of these things. So really thinking on the front end about how we build the systems so that reimbursement becomes easy, making sure we cabinet it off to eligible populations. The more diligent you are on the front end about only moving people into room key, into NCS that are eligible, the more certainty you have on the back end that you're going to get reimbursed for most, if not all of that. So we haven't, to my knowledge, we have not seen a reimbursement request denied up to this point. Now, we'll see as we get closer to 100% of the paperwork in, we'll see. But so far, what has been submitted has been processed timely and without any sort of major denials. Here and there, they'll come back on us, but without any major denials. FEMA, I would just say FEMA has been a great partner. Even going back into the Trump administration, when we obviously had some differences of opinion with them on many things, including on homelessness. FEMA and especially Region 9, which is our region here in California, have been a tremendous partner. I think it's important to criticize when criticism is warranted, but also to issue praise when people do well. And I think FEMA under Trump and then FEMA under President Biden now have been real partners here. And early in the pandemic, putting people in hotels when you're responding to a disaster is not exactly rocket science, right? But under category B, only congregate shelter was pre-authorized, right? So we had to have this whole discussion with FEMA about why not congregate, right? And we have had a couple of communities in California that have insisted on congregate shelter. They just don't want to do the hotel thing. And, really tragically, there have been some really terrible outbreaks. In the San Diego Convention Center comes to mind. We had to break the obvious answer and get to the unobvious. And I will say that, it's credit where credit is due. FEMA has been, look, they're bureaucratic, but aren't we all? They're bureaucratic, but they got to yes. And I think a lot of credit is due to FEMA for that, and the leadership at Homeland Security and of course in the Biden White House of pushing forward for this 100% backwards and forward. So look, I think I'm rambling a little bit, but long way of saying we feel in California and Region 9 that FEMA is a partner, not an adversary. Right. And I know that may not be the case in every region across the country. I stipulate to that point. But here in California, no matter who the president of the United States is, we have felt that FEMA has been pulling with us. Now we have to clear their hurdles. We got to jump through their hoops. We got to, thread the needle. But they're a partner, not an adversary to us on this. And maybe we're lucky in that regard. I don't know.
No, I would agree. I think I've been surprised at the level of flexibility and the increase in communication, at least between folks on the federal level about that. So yeah, as you said, props where props is due. Well done on that. And did you have something to add?
Yeah, I was just gonna say that I found the same when working in Houston after Hurricane Harvey. I really benefited from working closely with the FEMA team, so that they wanted us to be as clear up front as they wanted, you know what I mean? Like they wanted it all to work as well, and were super helpful and continued to help us through the process of getting reimbursed through the whole thing. So.
Yeah, for sure. Yeah, and I'll say if they're able to make other reforms, we at NLIHC have a long list of ways to make recovery assistance more accessible to low-income households and to improve the country's disaster recovery system writ large. So looking forward to working with them as we continue. So I think we're just about out of time. I just wanted to thank all of the panelists. I know Jermon and Shaylin had to drop off for another call, but just thank you so much for this excellent conversation about this important topic. We will record this and place it online, and just many thanks for all your work, and keep it up. Let's keep it going.
Thanks very much. Thanks, everybody.
Thanks all. And thanks to our
Thank you.
co-sponsors, National Alliance to End Homelessness and the National League of Cities. Talk to y'all later.
Bye-bye.